Kapelebyong as a district is predominantly a rural district, and social services, particularly health, are challenged.
For many expectant mothers in districts in eastern Uganda, access to health center is between 6 to 25 kilometers away. These hard-to-reach districts are grappling with the poor health service delivery as a result of few staff and inadequate equipment.
The average walking distance in Katakwi for patients is 14 kilometers, but it ranges between 5 to 20.
So they find local solutions to solve this problem, where sometimes they get community volunteers supporting them to give them maternal services.
A number of women have died on their way to the health unit or at the center due to complications and delays.
We have health centers in this district which only have one midwife. She has to work day, she has to work night, and that creates fatigue in terms of staff, and sometimes they are not in better position to provide quality care for mothers.
Sister Mary Caroline Ademere, who is the in charge of Angelic Health Center 2 in Kapelebyong district, is the only medical personnel here.
I'm alone in that facility and there's too much work. I'm even a clinician because I have to clock even patients. If these other patients also come. Even testing, you have to do even that one. So I'm everything in that facility.
In her absence, mothers are turned away and have to look for help elsewhere.
Always when I'm not around, those mothers go back. Even those ones who come to deliver, they have to go back.
We have asked government to give us additional wage to offer for this, to recruit for more staff, and we haven't been able to get a positive response from Minister of Finance and Minister of Health.
The district cannot maintain the cost of running the ambulance, which is broken down.
So even the ambulance, which has a linkage with maternal health, is spoiled, and it has been spoiled for the last 2-3 months.
Stella Itama, a midwife at Okoboi Health Center 3 in Katakwi district, says it is commonplace to deliver mothers at night using torches, which the patients have to buy for themselves. The solar panel that provided energy stopped working several years ago.
So when it comes to light, we are forced to use this solar torch, which is not it doesn't give us an adequate light. So we are forced to use this very one.
This, according to Paul Ochole, a senior clinical officer at Torma Health Center 4, coupled with the traditional norms, has caused many women to shy away from seeking maternal health services from the health units.
Like, of course, nearby facilities. Some of them end up in those facilities. And then, of course, we can't rule out the TBAs, traditional birth attendants. Sometimes they also take a small number.
So you can find that our indicators of immunization are very good, but deliveries are poor.
Dr. Ongala says the district is working with the former traditional birth attendants.
So we dialogue with TBAs to make sure that they escort their patients to the health center. And if as they do, they get a commission from the RBA funding.
With the support of the Swedish International Development Cooperation Agency, the Center for Health, Human Rights and Development (CEHAD) and its international partners is carrying out a joint advocacy for sexual and reproductive health and rights program aimed at building progressive sexual reproductive health and rights advocacy movement in Uganda to address the challenges faced by women.